We've already spoken about the political food fight over health care and also about the millions of people who could lose coverage if Obamacare is repealed. Now, let's look at how people on the front lines are impacted. Now, I'm talking in this segment about hospitals, and they are very concerned that the bills do not have a price tag or, for that matter, details about coverage implications. And they're even more worried about how this will impact people who need care the most. Well, the American Hospital Association wrote a letter to House committee leaders to voice their concerns, and it reads in part, quote, "We are deeply concerned that the proposed Medicaid program restructuring will result in both loss of coverage for current enrollees as well as cuts to the program that provides health care services for our most vulnerable populations, including children, the elderly, and disabled." Well, Jim Foy, he spent 17 years as CEO of the Riverside Health Care System, a group that operates 4 major health care facilities, including St. John's Hospital in Yonkers. Now, he's a partner in Hudson River Capital. It's a private equity firm focusing on healthcare startups in Westchester. And to that end here, let's bring in Jim. And Jim, you know, everything I read, without exception, hospitals are freaking out about the possibility of not just the repealing of the ACA, but the implications with these cuts to Medicaid. Why?
Couple of things, Richard. First, everything that we can see, it looks like dramatic reductions in Medicaid payments. In the past, the federal government reimbursed states for care that are provided to Medicaid patients based on what it cost them to provide that care and how many patients they had, and also what services the state chose to offer. New York State has been a very reasonable state. It's provided things like dental care to kids, which is critical for them to get a decent start in life. The feds are now changing this, according to the most that we can see so far, to giving a fixed amount per person. And if you spend more, you lose it. My understanding is that New York State is looking at a reduction of up to $4 billion a year just based on this one piece. Secondly, they're going to increase the cost to older citizens and to poor people, and in all likelihood, they're not going to be able to pay that. And then third, they're going to defund Planned Parenthood, which provides an awful lot of services in New York State to the patients who receive other services from hospitals. Those are just going to fall on the hospitals, and Planned Parenthood does a good job on them. And again, most of them have nothing to do with abortion. They have to do with women's health issues, and those are now going to be falling on the hospitals and the community. So those are the reasons, for the most part, that I think healthcare executives are concerned. And the last piece, I guess, is that we're not quite sure what happened. If you see, it was 4 a.m. this morning that the House Ways and Means Committee passed the bill. That seems kind of strange, and you kind of wonder what's included in that nobody knows that they had to pass it at 4 o'clock in the morning. So I think that's a pretty brief summary of why people are concerned.
Try, Jim, if you can, to put even a finer point, instead of broadly hospitals, safety net hospitals. We mentioned St. John's Riverside when you were there. It was one of those hospitals dealing with people that a lot of times fall through the cracks here, primarily people, whether they be indigent or really with acute needs here and not a lot of resources. Talk about the implications, these safety net hospitals under this proposal.
Absolutely. And so you have the state losing $4 billion a year in Medicaid. And while I would hope that the state would find another source of that revenue, I'm not optimistic that the state can just come up with $4 billion. So the state is probably going to reduce reimbursement to hospitals under Medicaid. As you said, people who were covered in the past and aren't covered now are going to come into the emergency rooms, where every hospital has a responsibility, both legally and ethically, to treat them. Those people they're not going to get paid for. And there's nothing in this bill that I can see that reduces the very, very high co-pays and deductibles that people are having now, which result in an awful lot of bad debt for hospitals. It's a recipe for disaster.
Jim, if the math is right, and some of the projections just to New York State alone to $4 to $6 billion, talk about some of the triage choices hospitals are going to have to make here.
Yes, and the reason is New York has been wise, I think, in terms of providing a lot of services that in the long run help our country and help our economy. You have a kid who's able to go to school because they have good dental care and they have good primary care. That kid is a lot less likely to wind up unemployed or in jail. We eliminate those, and the kid's ability to learn goes down the tube. So yes, and that's why I think New York is at risk. And the other thing I didn't mention, but it really bothers me, the biggest benefit that seems to come out of this is from the wealthiest of our fellow citizens. by reducing a whole bunch of taxes on them that paid for these services in the past. And I would think, tell me, it sure seems to me like a conflict of interest. I think President Trump himself, is probably going to save well over $1 million a year in taxes while people go uninsured.
Jim, in the next segment, we're going to talk to somebody on the front lines of opioid treatments here, an addiction expert in terms of their concerns as to where this might be happening in New Jersey. But talk about some of the things that none of us are thinking about, but people that you deal with are. What are some of the things that will change that we're not even thinking about right now that could be on the chopping block?
Well, you mentioned Medicaid is the biggest payer for people who have addiction problems. Those are not profitable services for the most part. Maybe if you're taking care of the very wealthy, it's profitable, but those are services that hospitals usually lose money on. If Medicaid cuts on them, those services go out the window. And I would just hope you wind up funding additional money for the police and the prisons, because if you're not treating people for addiction, they're going to be breaking into people's houses to get the money to pay for their habit. It's a sad thing to say, but I think it's a pretty clear fact.
Finally, Jim, we're using a lot of acronyms. We're talking math here. We're talking dates when this could happen, and there's politics. But real simply, it's not just poor people that are going to be hurt potentially the most here. It's also middle class and the elderly that could really be harmed here, right?
Absolutely. And the one thing I remember, it was said years ago to me, and it still makes so much sense. When you go to a hospital, you can have the best insurance in the world. You can have the American Express Platinum card, but there's no such thing as a Medicaid nurse. So if there's cuts in nurses, and it can be at St. John's Hospital or it can be at Northern Westchester in a very affluent community, there's no such thing as a Medicaid nurse. If they're cutting costs to all the hospitals, they're cutting the services that are provided to any person who goes into those hospitals. It's not just the poor person, although that person is clearly going to be impacted, but it's any person who goes into that hospital, because there's no such thing as a Medicaid nurse.
Jim, thank you very much. Got a feeling we're going to be talking again while this whole thing gets sorted out in D.C.
Thank you. Have a good day.
All right, everybody, coming up next, the unintended consequences of repealing Obamacare, how the Republican plan could devastate people seeking treatment for drug addictions. Well, a man who's running one of the largest facilities in New Jersey, he'll join us to voice his concerns.